I'm Sona. I'm a medical student hailing from Kerala and one among the 32 changemakers of the FAIR Project 2023. We all grew up wanting to change the world, right? But the question always remained how? How do I change the world? That's where the FAIR Project came into play for me, equipping me with a methodology and access to resources to actually do something meaningful. To not just engage in active dialogue but translate the said dialogue into action. When asked to present my showcase, I decided that I should take up a premise that is not only something personal but at the same time can create a larger public impact. Healthcare sector is not just a career choice for me, but something I'm deeply passionate about. Every day, we spend time at the hospital not just learning and applying knowledge but also interacting with people from all kinds of socio-economic backgrounds. During my postings, I've noticed that sexual health, unfortunately, is still something addressed uncomfortably, and hence my showcase is Getting Down to Business, an attempt at breaking the stigma surrounding sexual health. As much as this is a premise for discussion, it's a project I want to take up as I've access to a hospital setting and given my area of study the ability to actually impact change. Before we delve in further, I wanted to define a few parameters to at least start off so that I can actually get the project up and running. Sexual health, of course, concerns people from different age groups, from adolescents to geriatric population, individuals from all genders, all religious and socio-economic backgrounds. I want to focus mainly, at least at the moment, on a younger population, from adolescents to individuals in their 20s, simply for the reason that I am closer to their age and it might just be easier to get through to them, and they're the future that can actually create meaningful change, kill the silence, and break the taboo. I want to approach this project, of course, through the FAIR lens. So, first up, fact finding and familiarizing. As of 2022, 6 states in the country, namely Maharashtra, Gujarat, Rajasthan, Madhya Pradesh, Chhattisgarh, and Karnataka, have banned the provision for sexual education in schools or colleges, citing that it might or will corrupt the youth and offend Indian values, leading to promiscuity, experimentation, and irresponsible sexual behavior. A study conducted by UNICEF and the Population Council India about adolescents based on the research conducted and published between 2002 to 2013 found that only 45% young men and 28% young women seem to have a comprehensive knowledge about HIV and its prevention, and more in cities and rural settings. Same is the knowledge about HIV testing facilities, with only 42% young men and 30% young women among the 15 to 19-year-olds ever having heard of resources to actually get a health checkup. Even versus prevention of other STDs, with numbers falling well below 20% for both genders. 8% of all surveyed unmarried young women are not even aware of a single means of contraception or protection. In the context of female health and hygiene, a disproportionate amount of high-risk pregnancies occur among adolescents due to child marriages, with 62% of rural women mothering at least one kid when they have barely turned the corner from childhood themselves. Maternal mortality is highest among 15 to 24-year-olds in the face of immature reproductive bodies and poor antenatal care. Due to the taboo that exists in talking about sex, the ability to voice sexual abuse is also impaired. One shocking statistic states that nearly 50% of boys and girls each face sexual abuse in their young lives in India, according to a survey by Ministry of Women and Child Development. Now that we have the facts and familiarity of the concept of importance of sexual health education in adolescence, let's look at A. Alternative perspective. An alternative perspective would be a more traditional concept that stems from most often religious backgrounds. When I asked my parents about their thoughts on this premise, their reluctance to speak freely about the topic actually spoke volumes. But one point that was brought up was that the sexual health education would significantly be able to influence the knowledge being important. And considering how sensitive this topic is, it can have serious repercussions. This can potentially be solved by introducing a curriculum that is strictly followed, much like reading or math in school. Through the project, I would actually like to collect information and perspectives from people about why or why not do they believe that conversations about sexual health are necessary. That is my perspective. Now about introspection. The reason that I chose this topic might have been the fact that I have two younger siblings. I know, self-restriction. But it got me thinking about how dangerous it is when one does not have access to safe and reliable information about something so imperative to the human experience. Often due to peer pressure, adolescents turn to perhaps misinformation or even harmful resources for information, especially via pornographic content that can have serious negative images about sexual health and relationships in young adults who have no better resource to go to. To most of us, sex education was just a chapter in grade 10, or at max one more in grade 12 if you took a biology. Even then, besides reproductive aspects of sexual health, other aspects such as sexuality, pleasure, hygiene, etc., are rarely discussed. Despite being from a rather privileged family myself and a modern schooling setting, I didn't have access to right information. And then, how can we expect people in rural settings to even think about it? That is my take. And now we move on to the last part of the project, reason and rationalize. Given that this is a project I take up now and want to carry out in the next couple of months, it is difficult to have some kind of conclusion with respect to R, reason and rationalization. But this is what I'm hoping for with respect to the project, that I be able to provide access to at least one individual at the very least about sexual education. Equip them with the right resources and create an environment where they can talk about sexual health freely, ask any and all questions, and at least in part attempt to break the stigma surrounding sexual health. Sexual health is an integral part of human experience, and as someone who is at a position to create change, I want to step up, take this opportunity, and be the change I actually wanted to see. I know, a rather cliche line, but thank you, Fair, for the opportunity to even be able to voice out my concern and actually be able to take action. Thank you.